Hello, my name is Ashley Moore. I'm a student in the Doctorate Nurse Practitioner program in the Acute Care track at UAMS. Today I will be presenting on the study titled The Effect of an Early Resuscitation Protocol on In-Hospital Mortality Among Adults with Sepsis and Hypotension, a randomized clinical trial. This study was conducted by Ben Andrews, MD, Matthew Semler, MD, and Levi Muchemwa, MBCHB. And it will be reviewed today by myself, Ashley Moore, BSN RN. I would like to start with the background of this study. Sepsis and hypotension are major contributing factors in mortality in both the ICU and ED settings, particularly those in resource-limited environments. The purpose of this study was to evaluate whether implementing a 6-hour early resuscitation protocol reduced in-hospital mortality among adults with sepsis and hypotension compared to a usual care group. The methods the researchers used. The research design was a randomized controlled trial. The setting was conducted in a resource-limited emergency department setting in Zambia. The sampling and participants, a total of 212 adult participants were chosen who were diagnosed with both sepsis and hypotension upon ED admission. The data collected and instruments used. The participants were randomized into two groups. One was an intervention group, which involved early resuscitation protocols, and the second was a regular control care group. The methods of data analysis used. They used statistical analysis to compare mortality rates between the two groups. They used this with confidence intervals and determined p-values for significance. If you refer to Table 1 under the Purpose tab, you will see suspected diagnosis at the time of hospital admission for these enrolled patients. A majority of them had systemic infections such as malaria. They had infections of the lungs to include pneumonia and tuberculosis. Some patients had gastrointestinal system infections to include gastroenteritis and enteric fever. And there were also patients who had central nervous system and urinary tract infections. The researchers did mention that at the time of this study, there were patients that may have had one or more of these illnesses. Some patients had one, some may have had multiple. The results of this study. For the primary outcomes, the intervention group actually had a higher mortality rate at 48.1% compared to the control group of 33%. The difference in mortality was 15.1% with a p-value of 0.03. The secondary outcomes of this study, they found that there was no significant differences in organ dysfunction or length of stay observed between the two groups. They concluded that in resource-limited settings such as Zambia, an aggressive resuscitation protocol might actually inadvertently increase mortality rates. These findings emphasize the need to carefully tailor policies and procedures and resources in the context of the healthcare settings. Early sepsis interventions, while they are crucial for these patients that are sick, hospitals should also consider factors like fluid balance and resource constraints. And what are our implications for practice? This study highlights the importance of adopting resuscitation protocols to the specific resources available in those settings, such as Zambia in this study. Aggressive fluid and blood product administration may not always be beneficial for patients, particularly in low resource environments. And lastly, this study informs future investigators on optimizing early sepsis care while avoiding unintended consequences. I appreciate you listening to my presentation today. Below on the lower left-hand screen, you will see my reference for this study. Thank you very much for listening. Have a wonderful day.